In September of year 2000, the United Nations General Assembly ended the Millennium Summit by adopting a set of Millennium Development Goals, or MDGs. The MDGs are 8 international development goals that all 192 UN member states and at least 23 international organizations have agreed to achieve by the year 2015. In the Philippines, the national government's official development agenda focuses on addressing poverty and unemployment. Priority programs of the Philippine government stresses on poverty reduction through equitable growth, rural development, and social sector investment.
The Millennium Development Goals were commitments that were created in the United Nations in the year 2000. The Philippines, as a developing country, has received funding from a number of developed countries in order to meet goals 1 to 7. One of these goals is MDG number 5, or maternal health. The Millennium Development Goal number 5, or improving maternal health, is a true challenge in the Philippines. By 2015, we must meet this goal, as well as the others. Because women and children are the most vulnerable in our society. And the best way to meet this is to meet the needs for improvement as well as access to health facilities, equipment, training of health professionals, and most importantly, information and awareness.
According to the United Nations Development Program Philippines, the country has been facing difficulty meeting MDG 5 on improving maternal health, as 54% of pregnancies, translating to 1.9 million women, were unplanned. The UNDP reported that the lack of access to reproductive health services has caused 11 mothers to die every day due to pregnancy-related causes. There is also concern on the high incidence of HIV cases, with 126 new cases reported in 2009, the highest since 1984.
The Department of Health has crafted the Women's Health and Safe Motherhood, an integrated service delivery package to reduce maternal mortality. Here, it outlines the steps on how to contribute to the national goal of improving women's health by implementing a sustainable, cost-effective model of delivering health services and that increase access of disadvantaged women to enable them to safely attain their desired spacing and number of children. The Department of Health will also be establishing core knowledge, base, and support systems that will guide program managers and policymakers in the replication of good practice models.
For the province of Lanao del Norte, innovative solutions and an uncompromising political will are the order of the day, as the provincial government, led by its visionary governor, Kali Dimaporo, forged towards a healthier future for Lanao del Norte residents. Charting the steep path towards the effective delivery of healthcare services, Governor Dimaporo has identified 6 key areas to upgrade to realize a healthier and more empowered citizenry.
After reading Vision 2020, nakita ko na it can be basically addressed with 3 simple agendas: social programs, infrastructure, and rural livelihood. Sa social programs, I felt that healthcare was the most important because this is what we needed. My parents have been very successful during sa panahon ng daddy ko in providing peace and order, unity between the Muslims and Christians. Sa panahon ng mami ko, with the teamwork that she had with Congress, when my father was sa Congress, they were able to do so much improvements in terms of infrastructure, at saka ang legacy ni Gob Angging was the Mindanao Civic Center. You know, a jewel for all of us here in Mindanao. Ako naman, I wanted to add to the family legacy, and I've chosen the hospitals as a problem that I wanted to solve. The reason was very simple. Sa 2007 campaign, every time sinasabi ko yung mga wishes o yung mga ideas of improving healthcare services, the people are very happy. Pumapalakpak sila. And based on that, I decided to go all out in improving healthcare services. In addition, by improving healthcare services, we also help the nation in addressing the Millennium Development Goals, specifically decreasing maternal mortality and decreasing infant mortality. These are the objectives of the provincial government, wherein we streamline with the national government.
The provincial government is moving towards quality healthcare delivery system of the province and in the attainment of the Millennium Development Goals. Reduction of infant mortality rate, reduction of the maternal mortality rate, and reduction of the malnutrition prevalence rate of the province, increase household with access to safe water, and increase household with access to sanitary toilet facilities, and combat or fight against infectious diseases like malaria, filariasis, schistosomiasis, dengue, and the most important now in the province is to fight against tuberculosis. Sa slogan sa atong mahal ng gobernador, Governor Muhammad Khalid Quebranza de Maporo, ang himsog nga katawhan maoy hulagway sa maayong pangagamhanan, ug ang maayong pangagamhanan maoy haligi sa kalambuan.
First on the list is PhilHealth coverage. The provincial government has created the Provincial Health Indigency Program for the universal sponsorship of Lanao del Norte indigents.
Mas mi-increase ang mga PhilHealth card beneficiaries ug gipatuman ang universal coverage sa maong programa sa administrasyon ni Governor Khalid Quebranza de Maporo. Kini nagpamatuod nga epektibo gayud ang maong initiative. Busa kami sa sangguniang panglalawigan wala magmakuli sa paghatag sa among suporta sa maong programa. We are fully aware sa development direction sa probinsya nga mahimo kitang competitive sa tanan aspeto sa mga programa o mga prohekto labi na gayud sa isgutanan sa maayong panglawas. Mas matutukan pa karon ang pagpatuman sa health sector programs gumikan sa pagtinabangay sa atong mga kongresista o ang atong probinsya nga gipanguluhan sa atong batan-on ug maabtik nga gobernador.
To give indigents, some of whom have no formal education, easier access to this essential program, the provincial leadership is implementing an open enrollment policy. Indigents only need to submit their birth and marriage certificates to be immediately enrolled to the program.
Kining PhilHealth card ni Khalid de Maporo, dako kay ni katabang sa amo ang mga kabos. Tungod kay akong anak na hospital, duha mi kasimana kapin dito sa Baroy, wala jud mi nabayran maskin piso. Daghan kayong salamat Governor Khalid de Maporo kay nakatabang mo sa among kabos. Daghang salamat. Kini nga programa sa PhilHealth Card, dako kayo migpasalamat nga mga kabus nga nakaabil ani. Kaya atong August 2008 na hospital ang akong mama sa Kapatagan Public Hospital. Wala gyud mi bayad masking gamay sulod sa duha ka semana. Nagpasalamat gyud mig nako ni Governor Khalid Quebranza di Mapuro ug daghan jud kaayong salamat niya.